Hello, I'm James Foster, Director of the Institute for International Economic Policy of the George Washington University, welcoming you to our series of short conversations with faculty affiliates on the COVID-19 crisis. Today I'm speaking with Jay Shambaugh, Professor of Economics and International Affairs at GW, Director of the Hamilton Project at Brookings, and former Director of the Institute for International Economic Policy. Jay is an expert on macro and international economics, but has worn many hats since serving on the Council of Economic Advisors and at Brookings. Jay, welcome.
Thanks for having me.
For some time now, you and your team at Brookings have been discussing the benefits of having automatic stabilizers in place to counter economic shocks like the current one due to COVID-19. Your 2019 book from Brookings entitled Recession Ready presents this idea. What are your main points?
So the idea of an automatic stabilizer is it's something that provides more demand to the economy through fiscal policy during a downturn and less when the economy is doing well. So kind of the classic example is unemployment insurance. When lots of people lose jobs, you spend more money on unemployment insurance, and that kind of gives some boost to the economy. And on the other hand, when lots of people are working, there's not much use of the unemployment insurance system. So the idea of automatic stabilizers is you put some portion of your kind of macroeconomic policy on autopilot, quite literally, and let the economic conditions determine what you're doing with fiscal policy to some extent. And one of the main arguments for this is that sometimes political arguments or just political timetables can get in the way and keep you from responding quickly to a crisis. And then on the other hand, there is this issue that as interest rates around the world have gotten lower, many central banks, including the Federal Reserve, are very close to zero with their interest rates, even in normal times, meaning they don't have as much what we think of their standard ammunition where they can just lower interest rates and boost the economy, which means we need fiscal policy to do more, which is something actually Jay Powell, chair of the Fed, said the other day, where he said they're doing everything they can, they're going to do more, but they could really use some help from fiscal policy.
In 2008, several Latin American countries effectively expanded their conditional cash transfer programs into stabilization programs to dampen the impact of the Great Recession. Are there existing programs in the U.S. that can be repurposed to avoid an extended recession due to COVID-19?
Oh, absolutely. And so the safety net, much like the conditional cash transfer program, the safety net is kind of your main automatic stabilizer. More people file, whether it's unemployment insurance, SNAP, or what used to be called food stamps in the United States is another just terrific automatic stabilizer. But the point of the book we did was to say we could do better than what we do. The U.S. has a relatively limited automatic stabilizer system. And so one way you could do it is make the unemployment insurance system more generous when you're in a downturn, kind of increase the payments, extend the timelines. This is actually something that Congress has done on their own. They've gone out and put, people may have heard of this, kind of $600 a week bonus payment on unemployment insurance. It's a really effective way to help cushion families on the one hand and boost the economy. But on the other hand, it's something that just has a deadline. It stops July 31st. And so things like that, you want them to be guided by where the economy is, not by an arbitrary timeline. But the conditional cash transfer system is a great example where rather than coming up with something brand new on the fly, which we all know administratively can be very hard, it's better if you already have these programs because then you can just dial them up or down. Or even better, let economic data dial them up or down automatically.
Yeah, I see. How crucial is the link between the federal government and state governments in addressing the current crisis? Is decentralization the best way to go? Or should there be policy coordination across the levels of government?
So there definitely needs to be coordination, and for one really simple reason, which is in the United States, the states all have balanced budget amendments. So they need to balance their budget, which in a downturn we know their revenues are going to go down, their sales taxes will go down, their income taxes will go down. And what we very much don't want is to have the states turning around and firing a lot of people because labor cost is their main expense in many cases. And so one of the real concerns you need to have is the federal government, who has the capacity to borrow, and the U.S. government can borrow at ridiculously low rates, to have the U.S. federal government step in and help the states out. And so you can do that, again, with an automatic stabilizer program, Medicaid is a huge cost to the states, and so one proposal in the book we wrote was to actually just have the federal share of Medicaid spending going up or down depending on the state of the economy in a given state. Beyond that, you could just kind of give direct grants to the states, especially in this instance, in the COVID-19 crisis, where they're not just losing revenues, they're spending so much more money. And Congress has given them some money to help cover their increased cost, but nothing has happened yet to help cushion the real drop in revenues. And so that's really disconcerting. The other piece, though, is that in the United States, a lot of the safety net is actually done at the state level. So in some cases, it's funded federally, but operationalized at the state. So you need a lot of coordination. Those $600 bonus payments I talked about in the unemployment insurance program, those have to get actually pushed out by the states. And in many states, they're having a lot of trouble actually just getting the money out the door. So you have people waiting 6 or 7 weeks to get those checks.
Yeah. Now, as an economist who's used to making trade-offs, can you weigh in on the question of opening the economy? Are the economic costs brought on by social distancing worth it, or are they just too great?
So I think one of the things that we need to recognize is that the government policy shutting down the economy has not been the main determining factor in what's happened to the economy. If you just look around, you saw whether it was people going to restaurants, whether it was firms making people work from home, shops shutting down, all of that actually preceded the shutdown orders in most states. And even as states have technically opened up in a few cases, you haven't seen kind of a roaring back economy. The main thing holding back the economy right now is that people are worried about getting sick and dying. And so you can't trade off public health against the economy. The thing that will restart the economy is fixing the public health situation and giving people confidence. So having enough tests out there where people honestly believe that the people they are encountering are not sick. Having enough treatment so that people know, well, if I get sick, I don't need to worry, there is care for me. And so I think anything you can do on the public health front actually is the thing that would boost the economy. And certainly the biggest would be getting a vaccine. And so, anything you can do, any amount of money, honestly, you could feasibly spend to accelerate a vaccine would be money that would be incredibly well spent in terms of cost benefit. Beyond that, people have done cost benefit analyses where they use terms like only an economist would, where you talk about the value of a statistical life and things like that. And most of those calculations show against the potential for a completely unchecked virus killing a very, very large number of people, huge amounts of economic costs are worth paying to avoid that, which I think strikes most people just as instinctive, but economists like to run the numbers. But I really do think the kind of dynamic people have been putting out there of health on the one hand versus economics on the other is often a false choice, because if states open up and the virus resurges because they just open up everything, then I think you'll see those states shut back down either by law or just people will themselves shut the economy down. And so we really need to fix the public health to fix the economy.
Well, Jay, thank you so much for being with us today.
Thank you, James.
That was Professor Jay Shambaugh with a brief conversation on economic policy responses to COVID-19. I'm James Foster. See you soon for another Institute Conversation.